I distinctly remember the day that I met you, or not met you, but like started to get to know you. I had a miserable day at school. And I had a miserable day at school because we had just gone to a K2 system. And so I had a lot of young children transitioning, and there were behavioral challenges. And even in the best of situations, it's very difficult to work with young children because they don't have the language to say what they're feeling or even understand what they're going through. And so they express themselves in behavior. They touch, they move, though that's the language that they understand. I was just frustrated because our teachers were working so hard, and that was during a time well before the pandemic where we all were starting to see a rise in some of the issues that young children were bringing to school. And I had to go to a KITE meeting. It was my turn, and so I went to the KITE meeting, and I love KITE, but I was really ready to go home and have that glass of wine. But I went to the KITE meeting, and I was sitting on the side, and then there was, I can't remember who was in between me, and then there was Dr. Calnen. And Dr. Calnen started to talk about what he was seeing in his practice and what his colleagues were seeing in terms of the number of children that were really starting to experience trauma, stress, and it was playing out in all different ways in the school and the family. And we as KITE needed to start to address that. And it was like the universe said to me, go to the KITE meeting, LeAnn, because you're going to meet the person that's going to help you grow as an administrator. And not all of us have the gift of being able to have multitudes of people who can challenge them in their professional growth, but I am so grateful that I was able to. And Dr. Calnen, you have been a mentor and a model for me and for so many of us. I've learned from you patience. I've learned from you gentle persuasion. I've learned from you to expect kindness and goodness from everybody. And I've learned from you to be quietly and consistently determined to get things done with patience. You have changed what Enfield looks like. We have Child First. We have Circle of Security. We have groups of pediatricians meeting with us that never would meet with us before. We have Sparkler starting to be a tool that preschool and kindergarten teachers can use to communicate with physicians, and it has changed what we look like. And so we're so grateful for you. And the way that we wanted to express our gratitude to you is to give a gift to Enfield so that everybody can experience in some small way the goodness of you. And that's why we brought this bench for you, a buddy bench.
And you get the honors of cutting the ribbon, Dr. Calnen.
That's what you want.
Whatever you would like to do.
Everybody, 1, 2, 3.
Yay!
3. So it says, placed here in gratitude for the inspiring work of Gerald Calnen, early childhood advocate. All who sit here can be a friend.
Thank you, everybody. So it's a real honor to be associated with LeAnn and everybody on the team, the whole KITE team. And it's been an inspiration because I think it's so rare when you get a community to come together to collaborate on something like this. Everybody that belongs to KITE is really inspirational. And I've met so many fantastic people and friends on this journey. And I've also learned to become a better pediatrician because KITE pediatricians have to be collaborative. That's part of the medical home model. I'm not sure how many of you are familiar with the medical home model. You hear the term bandied about all the time, but nobody really knows what it is. It's not the same thing as a pediatric practice. The medical home model is an ideal that pediatricians aspire to. It's what they work for. And it is based on a number of critical tenets, one of which, I think the most important of which, is the ability to collaborate. And that is tough for pediatric practice because in a busy practice, you've got about 20 minutes, probably less nowadays, 20 minutes from patient to patient And who has the time to sit down and manage care coordination under those circumstances? It's really just about an impossible feat. So my hope is that by means of KITE, in the years to come, and maybe this is something to think about in our 5-year plan, that we can work with active pediatric practices to figure out a way that they can work with KITE to at least plug needy patients into appropriate resources. Something just to think about. But I think it would be.
FRC, you're listening to.
Yeah.
Yes, yes. I'm looking at you and you. You guys have been great. Working with the FRC has really been an absolute pleasure. So this is the opportunity for primary care pediatric practices to come closer to that ideal of the medical home, to become more collaborative. And thanks to KITE, I think that can be made possible. Thank you very much.